Hello and welcome to our second video on telemedicine. In the second lesson on telemedicine, we will explore the ways in which health insurance companies can leverage telemedicine to reduce healthcare costs, provide better access to healthcare services, reduce administrative costs, and improve overall health outcomes for their members. Telemedicine offers a range of benefits to health insurers, including lower costs, increased efficiency, and improved patient outcomes. We explore the different ways health insurers can implement telemedicine, including virtual consultations, remote monitoring, and telehealth services, and the benefits these services can offer to both insurers and their members. We will also discuss the potential challenges of implementing telemedicine, such as regulatory issues and technology limitations, and how these can be addressed to ensure the successful implementation of telemedicine services by health insurance companies. We will discuss the benefits of telemedicine for patients, healthcare providers, and insurers, as well as some of the challenges and opportunities of implementing telehealth services. Join us as we dive into the world of telemedicine and discover how it can help to transform the healthcare landscape. Factors contributing to the rise in the cost of medical treatment. The rise of medical treatment costs can be traced back to the early 20th century when advances in medical technology and the development of new treatments and therapies led to increased demand for medical services. However, it was not until the post-World War II era that medical treatment costs began to rise significantly. Some of the factors are: 1. Expansion of health coverage. One of the major factors contributing to the rise in medical treatment costs was the expansion of health insurance coverage. The introduction of Medicare and Medicaid in the 1960s, along with the growth of private health insurance, led to a significant increase in demand for medical services. As a result, healthcare providers were able to charge higher prices for their services, which contributed to the overall rise in healthcare costs. 2. Advance in medical technology. Another factor contributing to the rise in medical treatment costs was the development and use of advanced medical technology. The introduction of new medical devices, imaging machines, and pharmaceuticals led to higher costs for healthcare providers and patients alike because of the initial costs of acquiring this equipment. 3. Aging population. The third factor is the aging of the population, and the growing prevalence of chronic diseases also contributed to the rise in medical treatment costs. Chronic diseases such as diabetes, heart disease, and cancer require ongoing medical treatment, which can be very expensive. 4. Inflation. Inflation is a major driver when it comes to increase in healthcare costs. Inflation is the general increase in prices of goods and services over time, and it affects healthcare costs in several ways. First, inflation can increase the cost of medical equipment, pharmaceuticals, and other supplies used in healthcare provision. When the cost of these supplies increases, healthcare providers charge more for their services to cover their expenses. Second, inflation affects the cost of labor in the healthcare industry. As wages and salaries increase, healthcare providers will charge more for their services to cover their labor costs. Third, inflation will impact the cost of healthcare insurance premiums. As the cost of medical treatment increases due to inflation, health insurance companies will increase their premiums to cover their expenses. Other factors contributing to the rise in medical treatment costs include administrative costs, medical malpractice insurance, and lack of price transparency in the healthcare system. In recent years, efforts have been made to address the rising cost of medical treatment, including efforts to promote preventive care, improve access to affordable medications, and increase price transparency in the healthcare system. The use of telemedicine and other technological innovations has also been touted as a potential solution to reducing healthcare costs by increasing access to care and improving the efficiency of healthcare delivery. However, there is still much work to be done to address the complex factors that contribute to the rising cost of medical treatment. The main focus of this video is how health insurance companies can use telemedicine to reduce health insurance costs. Telemedicine has the potential to revolutionize healthcare by making it more accessible, convenient, and cost-effective. In this video, we will explore how health insurance companies can leverage telemedicine to reduce healthcare costs and improve patient outcomes. Health insurance companies can use telemedicine in several ways to reduce health insurance costs, including 1. Encouraging telemedicine usage. Health insurance companies can encourage their policyholders to use telemedicine services by providing incentives such as lower copays or deductibles for telemedicine visits. This can help reduce the overall cost of healthcare as telemedicine visits are typically less expensive than in-person visits. 2. Reduce unnecessary in-person visits. Telemedicine can be used to triage patients and determine whether an in-person visit is necessary. This can help reduce the number of unnecessary in-person visits, which can be costly for both patients and insurers. 3. Improve chronic disease management. Telemedicine can be particularly effective in managing chronic diseases such as diabetes or heart disease. By providing patients with remote monitoring tools and virtual consultations with healthcare providers, insurers can help patients manage their conditions more effectively and avoid costly hospitalizations. 4. Increase access to healthcare. Telemedicine can help increase access to healthcare, particularly in rural or underserved areas where access to healthcare providers may be limited. By providing virtual consultations with healthcare providers, insurers can help ensure that patients receive the care they need before their conditions become more serious and costly. 5. Early detection and prevention. Telemedicine can be used to provide regular check-ins with patients to identify potential health issues before they become more serious and require expensive interventions. By providing patients with remote monitoring tools and virtual consultations with healthcare providers, insurers can help identify potential health issues early and provide appropriate care to prevent more serious health problems from developing. 6. Lowering the cost of medical procedures. Telemedicine can also reduce the cost of medical procedures. By allowing doctors to remotely monitor and diagnose patients, unnecessary procedures can be avoided, leading to cost savings. 7. Improving preventive care. Telemedicine can help health insurance companies improve preventive care. Remote monitoring and follow-up visits can help prevent chronic conditions from becoming worse, which can lead to fewer hospitalizations and lower costs. 8. Reducing readmissions. Telemedicine can also reduce hospital readmissions. By providing patients with remote monitoring and follow-up care, health insurance companies can help prevent complications that may require hospital readmission. 9. Improving access to care. Telemedicine can help health insurance companies improve access to care, particularly in rural or underserved areas where access to healthcare may be limited. By providing remote access to healthcare professionals, patients can receive timely care without the need for in-person visits. 10. Encourage the use of telemedicine. Health insurance companies can encourage their policyholders to use telemedicine services instead of in-person visits to healthcare providers. Telemedicine can be used for routine checkups, follow-up visits, and consultations with specialists, which can significantly reduce healthcare costs. 11. Provide coverage for telemedicine services. Insurance companies can offer coverage for telemedicine services as part of their health insurance plans. This can encourage policyholders to use telemedicine services and reduce their out-of-pocket expenses. 12. Reduce administrative costs. Telemedicine can reduce administrative costs for health insurance companies. For example, electronic health records can be used to store patient information, reducing the need for paper-based records. Additionally, telemedicine can streamline claims processing and reduce the need for manual data entry. 13. Improve patient outcomes. Telemedicine can improve patient outcomes and reduce healthcare costs by providing better access to healthcare services. For example, patients in rural or remote areas may have difficulty accessing healthcare services. Telemedicine can bring healthcare services to these patients, reducing the need for costly transportation and travel. 14. Improve health management. Telemedicine can help insurance companies better manage their policyholders' health by providing real-time data on health status, medication adherence, and other factors that can impact healthcare costs. Conclusion: health insurance companies can use telemedicine to reduce costs by improving patient outcomes, reducing the need for in-person visits, and providing access to care in underserved areas. By encouraging telemedicine usage and providing incentives for virtual visits, insurers can help patients receive the care they need while also reducing the overall cost of healthcare. Overall, the use of telemedicine can help health insurance companies reduce costs by improving access to healthcare services, reducing administrative expenses, and improving patient outcomes. In our next lesson, we will tackle the following topic: benefits telemedicine provides to patients, healthcare providers, and health insurance companies.